Good evening, everyone, and welcome to tonight's telephone town hall. My name is Mitchell, and I'm with Congressman Dan Kildee's office, and I will be the moderator for tonight's telephone town hall. Congressman Kildee is looking forward to taking your questions live and discussing the American Rescue Plan, a new law that was just passed by Congress and recently signed into law by the President to help Michigan families, seniors, and small businesses during this ongoing coronavirus pandemic. Right now, we're just dialing out to thousands of other mid-Michigan residents who will also be listening in on tonight's call. It takes us just a few minutes to complete that dial out, so thank you so much for your patience. Tonight, again, we're going to be giving you the latest information regarding the coronavirus pandemic, including details about the recently passed American Rescue Plan, as well as updates about the ongoing vaccination efforts in our local community. We'll be discussing when working families, seniors, and small businesses can expect additional economic relief, including additional stimulus checks. Tonight, we're joined live by representatives with the Tax Policy Center, who will be outlining new economic relief that is in the American Rescue Plan. We're also joined, in addition to the Congressman, by local health department officials across the 5th Congressional District, including Dr. Kaylee Blaney of the Genesee County Health Department and Dr. Thomas Bender of the Bay County Health Department. Both are here to help answer your questions live about ongoing vaccination efforts in our communities. If you have questions at any point throughout the event this evening, Congressman Kildee and our speakers will be taking your questions live. So just press 0 on your phone keypad, including right now if you'd like to be added to the queue. We're going to try to get to as many of those questions as possible. Again, my name is Mitchell, and I'm going to be the moderator for tonight's telephone town hall with Congressman Kildee. We're going to be talking about the American Rescue Plan, passed by Congress and signed into law by President Biden to help Michigan families, seniors, and small businesses. Right now, as I mentioned, we're just finishing that dial out to thousands of other mid-Michigan residents who will be listening in on our call tonight. It takes just a few additional minutes to complete that dial out, so I appreciate your patience. We'll get started in just a moment. For those of you that are just joining us, my name is Mitchell. Good evening. I will be the moderator for tonight's telephone town hall. We're joined live tonight by Congressman Kildee, who is looking forward to taking your questions and discussing the American Rescue Plan, which was a new law that was passed by Congress just last week and recently signed into law by President Biden to help Michigan families during this pandemic. We're just finishing that dial out here for about another minute or so to thousands of our mid-Michigan neighbors who are also going to be listening in on tonight's call. Takes just a few minutes, like I said, to complete that dial out. We're going to be giving you the latest information tonight about the coronavirus pandemic, including the details on the American Rescue Plan, as well as updates on the ongoing vaccination efforts in our local community. We're going to be discussing when families and when seniors and our small businesses can expect some of the additional economic relief in the American Rescue Plan, including additional stimulus checks. As I mentioned previously, we're joined live also, in addition to Congressman Kildee, by representatives from the Tax Policy Center, who are going to be helping outline the new economic relief that's in the American Rescue Plan. And we're also joined by our local county health department officials from across the 5th Congressional District, including Dr. Kaylee Blaney in Genesee County and Dr. Thomas Bender in Bay County, to help answer any questions you may have about the ongoing vaccination efforts in our communities. If you have questions at any point throughout the evening for Congressman Kildee or any of our other speakers, if you can just press 0 on your phone keypad to be added to the queue, we're going to try to get to as many of those questions as possible. And again, if you are just joining us, my name is Mitchell. I'm going to be the moderator for tonight's telephone town hall with Congressman Kildee. We're going to, as I said, talk about the American Rescue Plan, just passed by Congress and recently signed into law by President Biden, and update you on local vaccination efforts in our community. So with that, we are, looks like, finishing our dial-out. So Congressman Kildee, I will turn it over to you for opening remarks. Congressman Kildee.
All right. Well, first of all, thank you, Mitchell, and thank you to everybody for joining us this evening. This is another in a series of these calls that we've been doing, and I want to thank the participants and especially those experts who have joined us. This is the 6th, actually, of the telephone town halls that I've hosted in recent months to keep everybody up to date on what's happening during this terrible pandemic. As Mitchell mentioned tonight, I'm glad to be joined by Elaine Mogg from the Tax Policy Center, Dr. Kaylee Blaney from the Genesee County Health Department, and Dr. Thomas Bender, who's become a bit of a regular with us and has joined us for many of these calls. He is from the Bay County Health Department. You know, the sad reality is that we have passed a pretty grim milestone, the one-year anniversary of the first COVID-19 death in the United States. Since that time, in my own congressional district, right here in the 5th District, we have lost more than 1,675 people. Every one of those people, a sibling, a parent, grandparents, beloved family members, they've had their lives cut short by this virus. And so I first want to just offer my sincere and deep condolences to those who have lost loved ones during this pandemic, especially those people in the 5th Congressional District. Our community has had great losses, and we've lost leaders and friends, people like Dr. Nat Bertley, once the Flint School Superintendent, Reuben Burks, a labor leader from right here in our hometown, and for me, it's personal, a high school classmate and friend, Deacon Al Peacock. COVID-19 is a health crisis, but it's also created an economic crisis. So 1 year later, this pandemic's not over. Michigan families, our seniors, small businesses still need support to get through this crisis. We see the light at the end of the tunnel, but we are still in it, and we still need help to get through the crisis. And that's why I pushed for and Congress passed a new $1.9 trillion economic relief plan, the American Rescue Plan. As a member of the Budget Committee in Congress, as well as the Ways and Means Committee, I helped to craft a significant portion of this legislation. And just last week, I voted to send this new economic relief to the President's desk. And on Thursday, President Joe Biden signed the bill into law. So my top priority has always been, continue to will be, to ensure that our state has the resources that it needs to respond to this outbreak. This American Rescue Plan includes the additional economic relief for Michigan families, for seniors, for small business, and for frontline workers. So I want to just take a couple of minutes to summarize what is included. So here are the four main pillars of the American Rescue Plan that you need to know. It's more money in people's pockets, more vaccine shots in arms, reopening our schools safely, and support for small business. So first, with this bill, we finish the job of the $2,000 checks for Michiganders. So this bill provides an additional direct payment of $1,400 per person, added to the $600 that we sent in December, and bringing the total relief to $2,000 per person. And even though we just passed this relief bill last week, constituents have already reached out to let me know that they are seeing this stimulus check landing in their bank accounts, which is great news. So you will likely get this payment, this next $1,400 payment, or whatever the payment totals for your household. You're likely to get it the same way you received your prior economic impact payments, including through direct deposit or in the mail. This bill also expands, thankfully, tax credits for workers and families. The expanded child tax credit of at least $3,000 per child will be fully refundable, which means it's available immediately and directly in monthly payments to parents. Those will start in July. So this funding is really significant. It will cut child poverty in half. For Flint, for Saginaw, Bay City, up to Oscoda, all across this district, this tax credit will go a long way to support families. So I'm really pleased to have the Tax Policy Center on the call tonight to talk more about this new tax credit for children and how that will work and answer your questions. Second, with this bill, as I said, we speed up vaccine distribution by launching a national vaccination program that includes more community vaccination sites and scaling up testing and tracing, which we still have to do. It also addresses the shortages in personal protective equipment, or PPE, and other critical supplies. So under President Biden's leadership, we've been able to significantly ramp up vaccine distribution. In fact, this past Saturday, the United States administered almost 3 million vaccines in one day, a record. I'm even more hopeful that the end of this pandemic is in sight after a third safe and effective vaccine from Johnson & Johnson has been approved by the FDA. So now Congress has passed additional resources to scale up vaccine distribution and shots in arms as quickly as possible. Third, with this bill, we get our kids back in the classroom safely. This relief package will allow local school districts to reduce class sizes and modify their classrooms so that students and teachers can safely be together. This includes investing in improved classroom ventilation and the purchase of additional PPE. For our district, I was able to secure over $344 million for school districts in Genesee, Saginaw, Aranac, Bay, Iosco, Tuscola counties to help reopen schools safely. And fourth, with this bill, we extend support for small businesses, especially minority-owned businesses. Small businesses have been hit really hard by the coronavirus pandemic. So in the American Rescue Plan, we offer more targeted and direct economic relief for the smallest of businesses on Main Street, those that really need the help most. Lastly, as part of the American Rescue Plan, I was able to secure over $388 million for local counties and communities across the 5th Congressional District. This federal investment will go to support our local economy and services, including police and fire, 911 dispatchers, other essential government services. Our local communities have been on the front lines of combating the coronavirus, and I'm pleased to have worked really hard with them to get this additional funding. And I know one of our local leaders is on this call tonight, Mayor Sheldon Neely, with whom I've been working on how we're going to get this done in Flint. So this bill, the American Rescue Plan, it's a big piece of legislation. There's no doubt about that. But it was developed to match the size of the problem. The COVID-19 pandemic continues to impact every family and every part of our economy. So when we put this bill together, it was based on what we felt was truly needed for our economy, for our families, for seniors, for small business. And last, let me say this, we will get through this tough time. As a community and as a state, we have to make sure we're doing everything we can to prevent the virus from spreading to other people. Even as we see light at the end of the tunnel, we still have to continue to protect one another. Every day, more and more people are getting vaccinated, which is great. We still must recognize that every Michigander continues to play an important role in saving lives and slowing the spread by practicing social distancing, continuing to wear a mask, even if you're vaccinated, and regularly washing your hands. We'll get through this. We'll get through it together, but we all have to pitch in. So, if you want more information about all the resources that are available to you and your family, you can go to my website, which is dankildee.house.gov, or you can call my office and write this down. That phone number is 810-238-8627, and you can get more details on how all of this might impact you and your family. And I know I took a little bit of time, but I really wanted to make sure I got into the detail of what this does. So thank you again for joining us. And now I'll turn it back to Mitchell to continue the conversation, and I look forward to your thoughts and to your questions. Thank you.
Thanks so much, Congressman. As the Congressman said, my name is Mitchell. I'm the moderator for tonight's telephone town hall, and Thank you to the almost 8,500 people across the district who have joined us tonight for this conversation. We'll be getting to your questions here in just a moment. Again, if you have a question at any point throughout our telephone town hall, just press 0 on your phone keypad to be added to the queue. We're going to try to take as many of those questions as possible. And now I'd like to turn it over to Elaine Mogg, who is with the Tax Policy Center. She is going to be able to provide more information on the economic relief that's going to be available to Michigan families in the American Rescue Plan, including a couple of those items that the Congressman mentioned, like stimulus checks and child tax credits. So, Elaine, I'll turn it over to you for some brief remarks.
Excellent. Thank you so much. It's so exciting to see this legislation make it all the way into law. And I think I just want to underscore at the top that, we are in an economic crisis for many families, and that made the legislation necessary. So to sort of frame it up, at the Urban Institute, we estimated that going into 2021, we were going to see about 14% of people living beneath the poverty line. With this legislation, we expect that to drop to about 9%. And for reasons I'll explain, it's even better for families with children. We can see child poverty drop in half to roughly 7%. So not only is it necessary because of the relatively high rates of poverty we observe right now, but we also observe relatively high rates of food insecurity. So nationally, food insecurity during the pandemic has nearly doubled for families with children. Almost a quarter of families are reporting that they're not eating balanced meals, they're skipping meals, or they're cutting the size of the meals because there's not enough money for food. We also see issues related to rent. About 17% of renters are behind on rent, and on average, they're behind $5,600. That's roughly triple the rate we see in a typical year. So that sort of sets the stage for needing some impact financial assistance coming. And Representative Kildee, of course, highlighted the two most important things. Those are the direct payments, which are roughly $1,400 per person. If you are single and have income below $75,000, you qualify for that whole payment. If you are a single parent, if your income is as high as about $113,000, you qualify for the full payment. And if you're married, your income can be as high as $150,000 to qualify for that payment. On average, we expect households to receive a benefit of almost $2,300. But because it's a per-person benefit, families with children will see higher benefits, closer to $4,000 per family. Those are the first payments you're going to see, and as Congressman Kildee mentioned, they're already in the mail for many people. The second thing that's happening will happen later, and that's the expansion of the child tax credit. So your child whose age is 6 to 17 will be eligible for a credit of $3,000, and children younger than that will be eligible for a credit of up to $3,600. We expect that over 90% of families with children will be receiving a benefit from the child tax credit. And it used to be a benefit you received only after filing taxes, and there was a work requirement attached to that benefit. But this legislation has flipped that story on its head. And so rather than delivering the largest benefits to higher income families, this legislation delivers the full payment to the lowest income families, which is revolutionary in the tax world. Those payments should start anywhere between July and October, and you should expect to see about half of the full value of the credit delivered to you in this calendar year rather than needing to wait until you file your tax return. Those are the two big pieces of legislation, or two parts of the legislation that provide economic payments that I think people will see. And I'm happy to answer questions if there's more details wanted.
Thanks so much, Elaine. Really appreciate it. So now we're just going to start taking some questions for Congressman Kildee or Elaine or Dr. Blaney or Dr. Bender, who are with us as well. So our first question comes from Sandra. Sandra is from Flint. Sandra, your line is unmuted to ask your question.
Okay, I had asked a question a moment ago about the vaccinations, and we do wear our masks, I know that. Okay, what about the strains that are coming through? Will that vaccination cover that?
Dr. Blaney, would you like to take Sandra's question?
Yes. Hi, Sandra. Thank you for your question. The answer to your question is both yes and no. So recent data that has come out about the UK variant, that's the B117 variant, preliminary data suggests that the vaccination does respond well to the B117 variant. However, the Brazilian variant and the South African variant, the data isn't all in yet, but it's looking like the vaccine does not respond as well to those two variants. So as data continues to come out, we will keep everyone updated, but it still is very important to get that vaccine to cover the strains that it does cover and to mask up until we find out more information about the other two.
Thanks, Dr. Blaney. Our next question comes from Victoria. Victoria is from Flint as well. Victoria, your line is unmuted to ask your question.
Yes, question is for Dan Kildee. Who's going to determine where the money goes that comes to the city of Flint?
Okay, it's a good question. Thank you, Victoria. So the way the process works, whether it's the city of Flint government itself, which will receive financial resources, and also the Flint Community Schools, which will receive financial resources, those decisions will be made by the city government the same way they make decisions about their budget in general. This is just a new source of revenue. However, there are some limitations. It can't be used, for example, to reduce, to take the money from the federal government and then just cut local taxes to offset it. It can't be used for unfunded pension liability that they might have. And it can be used for categories related to the lost revenues that resulted from COVID, additional hazard pay for frontline workers, for improvements to water and sewer or broadband infrastructure, and then for direct relief and costs associated with the additional costs that the pandemic has caused. That can go to direct relief, for example, to households, to small businesses, to nonprofit organizations, to try to help deal with the consequences of the COVID-19 crisis. But to answer your question specifically, we deliver the resources to all the local governments, not just the city of Flint, because all local governments are getting some kind of help. And then they have to go through their normal process of making decisions about the use of that money. And I know in the case of Flint, because we've been in consultation with the mayor, his intention is to seek community input on that subject. So thank you for the question.
Thanks, Congressman. Our next question comes from Keith. Keith is from Mount Morris. Keith, your line is unmuted to ask your question.
Yes. I just got a letter from the Internal Revenue Service, and it tells me that I'm only supposed to get $600 worth. I know my income in the last number of years has been less than $50,000, miles, so on and on and on. Oh. Why the heck is it they're only telling me I'm getting $600?
Keith, we're having a little trouble hearing you, but I think if I have your question correctly, I think you had just received a letter from the IRS about the $600 payment, and you were wondering if you were also going to get the $1,400 payment. So, Congressman Kildee, do you want to answer Keith's question?
No, you got it wrong.
Oh,
okay.
Go ahead, Keith. Sorry.
We weren't able to hear you very well, Keith. You kept breaking up. Maybe you can try again.
And now I don't see Keith with us any longer, Congressman. I don't know if you want to maybe give a quick comment about the $600 payment previously passed by Congress and the $1,400 payment just passed by Congress, Congressman Kildee?
Yeah, sure. Well, what I'm suspecting may be the case, and a situation like this, really results in a person needing to call the office, and we can try to dig into it. But it sounds like what may be the case is that the letter relates to the past payment, because the payments that are coming as a part of this just recently passed legislation is $1,400 per individual. The December payment was a $600 payment. So I don't know if the caller is still on the line, and because we had difficulty hearing him. If he is, please just call the office, and we'll try to figure out specifically what your issue is. The number for our local district office is 810-238-8627. And this goes for anybody, and I know my staff does a great job, and they're working really hard. And so I know they accept this as just part of the responsibility. But if you have a problem, the most important thing to do is call, and we can at least try to figure out what the nature of the problem is and try to fix it for you.
Thanks so much, Congressman. Our next question comes from Benito. Benito's from Saginaw and has a question on unemployment insurance. So, Benito, your line is unmuted to ask your question.
Great. My question is, before the $10,200 unemployment reduction in our income, I would be disqualified from the $1,400 because I would be almost at $80,000 income. So if that is the case, when can we expect the $10,200 unemployment reduction to our income to take effect? And if I'm excluded now, will this now qualify me because I'll be below $70,000 in income for the stimulus money, the $1,400?
Yeah, I mean, that's a good question. In terms of the $10,200 exclusion from federal income taxes, that is for the 2021, I believe, for the 2021 tax year. But what I would suggest we do, Benito, is, again, have you contact our office, and we can look at your specific circumstances to determine what you can do to make sure that everything that's due to you actually comes to you.
Great. Thanks, Benito, for that question. Thanks, Congressman. Our next question comes from Frank. Frank is from Mount Morris. Frank, your line is unmuted to ask your question.
Yes, I have they've already answered my question about you telling me to call to the office, because my question was about the check, stimulus check. But now I have another question about your stimulus. Do I have time to ask that question?
Sure.
Go ahead, Frank.
Okay. About the shots that you get for your coronavirus shot. Now I've had both my shots, and my wife has had both of her shots. Now before I had the shot, I had I don't know if you can ask this question, but anyway, before I had the shots, I had I had no problem with no symptoms or anything like that. But after the second shot, we started getting a few symptoms, and we wear masks every day and all this stuff, and we be extra safe. But I'm just wondering if there's anybody on there could answer that question about, my wife lately, she's been kind of sick, and the symptoms that she's had, it seems like, she's had some effects behind it. And I was just wondering about who do we call and check on something like that. I mean, she don't have an outside doctor and thing she can go to.
Thank you, Frank, for that question. Dr. Blaney, do you want to try to answer Frank's question?
Yes. Hi, Frank. I don't really want to say too much because I don't know your wife's specific medical history, and I don't really feel comfortable, giving specific answers over the phone. So if she does not have a common doctor she sees and she does not have a doctor available to her, you should have her, she can call the health department tomorrow, and we can try and get her set up either with one of our federally qualified health centers or with a provider that would be able to see her, because that's more, she probably needs to see a doctor than to report it to someone.
Thanks, Dr. Blaney. Our next question comes from John. John is from Flint. John, your line has been unmuted to ask your question.
Hello, I was wanting to find out. I know the new COVID relief package has extended the federal unemployment benefits till September, and I was wanting to know if the state has also extended unemployment benefits as well.
Congressman Kildee, do you want to talk about the unemployment benefit extension part of the American Rescue Plan?
Sure. So what the federal government did was to extend the unemployment insurance benefit, including the federal supplement, through September 6th. The state typically then will match its unemployment extension with what we provide. There is an issue that I know is going to catch a lot of people, and that's because the unemployment rate in Michigan has fallen below 8%. So some of the extension of the extended unemployment might end up resulting in some people getting cut off. But this, again, is one of those things where we have folks on my staff who can look at somebody's specific situation and determine what they might be eligible for. And I know part of the problem, honestly, has been that the state has been completely overwhelmed with unemployment claims, and it's been difficult to process some of those. So if you want to reach out, again, our number is 810-238-8627. We'll take a look at your specific situation.
Thanks, Congressman. Our next question comes from Bill. Bill is from my hometown of Bay City. Bill, your line is unmuted to ask your question.
Thank you very much, and thank you, Congressman Kildee, for holding these town hall meetings on the telephone. My first question, did I hear in the American Relief Act that there's going to be help with health insurance premiums? In my particular case, I was wondering about my Medigap premium, whether there was any reduction or help in this piece of legislation. And my second comment actually was, I don't know who organized the Michigan National Guard to help with the vaccination process, but a week ago, yesterday, Sunday, I got my vaccine at Delta College here in Saginaw. Actually, I'm from Bay City, but just a wonderful experience. I mean, these guardsmen, it was like a well-oiled machine. I was so impressed. So I want to say thank you for whoever organized the Guard and helping with the vaccination. But is there any health insurance premium reduction in this piece of legislation, Congressman? And I'll wait for your answer.
Yes, thank you for the question, and also thank you for your comment about the National Guard. I've been spending a lot of time with the members of the Michigan National Guard lately. They've obviously been working very hard to make sure that we get shots in arms, as you just pointed out, but we've also had quite a number of Michigan National Guard units helping to guard the United States Capitol in the wake of the attack that took place on January 6th. And so I've spent some time with them lately, and these are people who really do us proud. So I appreciate you giving them a shout out. I share your views on that. Regarding health coverage and access to care, the legislation does increase the support for health insurance premium for people who buy through the marketplace. We can look at the specifically how you procure your Medigap coverage to determine how that might affect you. The one thing it does is it ensures that that there's a limit on the percentage of an individual's income that would go to healthcare premiums. It just so happens for anybody that this might affect, subsidizes 100% of the premiums for COBRA, which is continuation coverage for people who've experienced their job loss, but you can continue to purchase COBRA is the way they continue to purchase the benefit that their employer was providing. So yes, the specific question regarding Medigap, I would have to have somebody look at that for you, but the intent is to provide support for those health insurance premiums and increase the support during the period of this legislation to minimize the out-of-pocket expenses for health care.
Thanks, Congressman. Our next question comes from Matthew Madigan. Matthew has a question about being vaccinated, but if he's still able to transmit the virus. So, Matthew, I'll unmute your line. I don't have your location, but I'll unmute your line to ask your question.
Hello, my name is Iva Madigan.
Oh, okay. Hi, ma'am. How are you?
I'm okay. It's okay.
Go ahead.
Okay, thank you. I'm a grandma, and I had both of my vaccine shots. And I had heard that I'm able to get to see all of my grandkids and hug them and all unmasked. So I'm concerned because I thought there might be a possibility I might still carry the virus and might be able to spread it. And I wondered if that is true.
Thank you for that question. What was your first name?
Iva.
Iva. Perfect. Dr. Bender, do you want to try to answer that question?
Sure. So the important thing to know about the vaccine is that it was tested to, in terms of its ability to prevent severe hospitalization and death. We are still learning about how effective the vaccine is at preventing infection or preventing transmission. Those were not outcomes that were part of the clinical trials to evaluate the vaccine, but they are topics of continued study. And so until we know more, it's just not yet possible to comment on whether or not they truly prevent infection and transmission. I like to think that that will be the case, but I'm going to wait for the evidence to back that up.
Thank you so much for that question. Our next question comes from Janice. Janice is from Pinconning. Janice, your line is unmuted to ask your question.
Yes, hello. Yeah, my name is Janice Pearson. I live in Pinconning. My question is, the people who are going to get the stimulus check, I understood before some of them is going to be direct deposit if you get direct deposit, but if you don't, it comes in the mail. Now, I got the $600 one, and I've had direct deposit ever since I've been on Social Security, and it came in the mail. So could it be either way, or?
Thanks, Janice, for that question. Congressman, do you want to answer Janice's question?
Yeah, that's a good question. And I have heard of other instances where people have direct deposit and typically get direct deposit for any refund they get from the IRS, which would naturally make us think that that's the way your stimulus check would come. You know, I guess there are just some exceptions to that might be based on unusual circumstances. There is, for those who can go to the website, there is a website that allows you to see, sort of track your stimulus payment and find out when it's going to come. For you, what I would suggest, again, and we can kind of look into this for you, the assumption is that however you got your last check or your last payment is how you will get the next one. If so, I would guess that yours will come in the form of a paper check mailed to you, but we can help work with you to try to figure that out. Typically, just to make sure that everybody understands, the way you got the last payment is almost certainly the way you're going to get the next one.
Thanks, Janice, for that question. Our next question comes from Patty. Patty is from Goodrich. Patty, your line is unmuted to ask your question.
Hi. I appreciate your time, and thank you, Representative Kildee, for having these meetings. It's an odd question. It's for the medical side of this. I recently had a severe allergic reaction, not to the vaccine, but to just they had given me a new med from my private doctor, and I don't feel as good as I did before. I don't have a fever, I don't have chills or anything, but I'm freaked out about getting the vaccine then. So I'm wondering, should I wait till I feel better? How do you determine what makes it okay to do it and take that risk? Or am I better just like staying isolated for a while longer till I feel ready to kick up my heels and go at this again?
Thanks, Patty, for that question. Dr. Blaney, do you want to try to answer Patty's question?
Yes. Hi, Patty. Anytime you're making a decision to get a vaccine or not, you really should consult your physician. Feeling under the weather like you're describing is not a contraindication for COVID vaccination by any means. It sounds to me like it's just more of you want to make sure when you get the vaccine it works, and you don't want to be getting a vaccine if you shouldn't. So I would recommend that you call your physician, explain how you've been feeling, explain your specific situation, and you can evaluate that with your doctor to make sure that all of your medical conditions and all of your concerns are being addressed when you make that decision.
Thank you, Dr. Blaney. Our next question comes from Jeff. Jeff is from Otisville and has a question about small business support. So, Jeff, your line is unmuted to ask your question.
Thank you. Senator Kildee, I represent the people out here in Otisville. I'm sure you're familiar with this town. It's about 800 people. But we do have a lot of small businesses. They're small, privately owned. If one of these businesses would desire to seek one of these loans, how do they go about doing that?
So it's a good question, and typically the best way for the Paycheck Protection Program or any of those programs is through the local bank. And it's especially important if they already have a bank that they work with or a credit union, that they go to their credit union or bank to ask for the SBA Paycheck Protection Program. They can process those, and that's turned out to be a really good thing because there's no way the Small Business Administration would be able to do all of these by themselves without having those banks step up. Now, the important thing to keep in mind is that the Paycheck Protection Program, it comes in the form of a loan, but it's a loan that is 100% forgivable if the terms are met. And basically the terms are pretty well spelled out, that they just have to use it for, those costs that they've not been able to cover due to the pandemic. It's a pretty, it's getting better in terms of how simple it is. But the main point is their local bank, your local bank, or whoever they bank with should be able to get them connected.
Well, good. Thank you very much.
You bet.
Thanks, Jeff. Our next question comes from Eleanor. Eleanor is from Flint. Eleanor, your line is unmuted to ask your question.
Thank you very much. My question concerns, I'm a caregiver for a 90-year-old bedridden mom. Will someone be able to come out to the home and give her a shot? Thank you.
Thank you, Eleanor. Dr. Blaney, would you like to take Eleanor's question?
Yes. Hi, Eleanor. That is something that we're working with various different agencies on to make sure that we're able to come out and work with different agencies that can provide those home services for vaccinations. So just make sure that your mom is on our pre-registration list, which can be found at our website, which is www.gcforme.com, and the registration link is right up top. If you're unable to register online, starting on Wednesday, we're opening a new call center to hopefully better handle the volume of calls coming in. And that phone number is, we're posting it currently right now on our website. That number ends in 4800. So if you're able to call that phone number on Wednesday, we would be happy to register her and make sure that we note in her file that she's someone that we would need to send someone out to.
Thank you, Dr. Blaney. We've gotten several questions about, it sounds like people have gotten both of their vaccine shots and they're wondering if they still need to wear a mask in public. So I'm just kind of lumping those together, and I'm wondering if maybe Dr. Bender, you can help answer those questions.
Glad to. So think of COVID-19 as being something that you can try to reduce your risk of experiencing through multiple strategies. A vaccine is a terribly important part of your layers of protection, but it's not the only one. Likewise, wearing a mask, watching your distance, and making sure you've got good ventilation if you're in a space that's indoors, or limiting the number of people you're with. All those are complementary to one another. Now, once you're vaccinated, the CDC has issued guidance that says that if you're in the company of other people who've also been vaccinated and everybody is otherwise well, then you can let your guard down a little bit and not wear a mask. But it remains important to wear a mask right now, because there's still an awful lot of the population that hasn't been vaccinated. If you enter the transportation system right now, you stand a very good chance of being exposed to the virus. That's been documented by the CDC. If you go to a large venue, indoor space, chances are you could probably be exposed there too. And what we have seen is that although the vaccine these vaccines are very good, remarkably good, they're not foolproof. There have been some cases of people who've become infected despite being fully vaccinated. The good news on that is that those breakthrough cases have been mild illness. People have not wound up dying from illness after having been fully vaccinated. There's been no cases of that. So right now, I would continue to wear a mask when you're in public. I would consider not wearing a mask if you're in the company of a small group that everyone has already been vaccinated. And then, await further guidance from CDC and elsewhere that we've gotten to that point where we can let our guard down more broadly.
Thanks, Dr. Bender. Our next question is from Cy. Cy is from Linwood and has a question about the American Rescue Plan and how we're paying for it. So, Cy, your line is unmuted to ask your question.
Okay, thank you. And, I guess this is for Mr. Kildee. Been talking to several economists and financial brokers and people that are really financial wizards, I would call them, really understand economics and finances very well. And I know that a lot of this is going to be borrowed money, but some of them say their predictions are that to repay this money, we're going to have to raise taxes and cut Social Security benefits. So I wondered if either of those two things were considered, and just what is the plan to pay back this money that's being borrowed, because our national debt is soaring.
Yes, it's a really good question, and I talked to a lot of those same people. In fact, we consulted with a lot of experts, economists, as we were putting this together. And so there's two ways I'll answer it. One, I think just directly to answer your question, there will be no cuts to Social Security. In fact, what we have is legislation that would enhance Social Security, and we would do that. And yes, this would mean some tax changes, but only for people who are very high earners, people who make more than $400,000 a year. And so we can make Social Security solvent for as far as the eye can see if we change the way Social Security is taxed, because right now, the first 120 or $30,000 of anybody's income is taxed. But for people who make a lot of money, that means that they're paying a much smaller percentage of their income to support Social Security. We have legislation that would have us begin to again tax Social Security taxes on money over $400,000 made by high-income earners. So there's no plan to cut Social Security. In terms of how we actually pay for it, this is where it does require an honest conversation. It will mean at some point we're going to have to look at revenues. My goal is that we look at the way the tax cut plan of 2017 benefited mostly people at the upper end of the economy. That legislation that cut taxes in 2017, I didn't vote for it because 83% of the benefit went to the top 1% of Americans. And so that's where we need to look when it comes to finding revenue to help pay off our national debt. But the other part of it that's really important is to keep in mind that the choices that we had when it comes to the economic impact of COVID were both paths going to lead to us having to face this question. In other words, you're right to ask the question, how do we pay for it? But we were going to pay for it if we did this COVID-19 relief bill, or we're going to pay for it if we don't, because if we don't do it, we take a very serious risk, if not the certainty, that the economy would not grow. And it's only when the economy really expands, which this legislation will do. In fact, many economists think we could see between 6 and 7% growth in the American economy just in the coming year, largely as a result of this infusion of money into the economy. When the economy grows, tax revenues go up even if the tax rates do not, because there's more money moving around in the economy that is then subject to taxation. So the real answer is we've got to grow the economy in order to generate enough economic activity so that the size of the American economy is bigger, and then we can bring down our deficit by having a larger economy that is subject to even the current tax rates. I think if we want to accelerate the reduction in our long-term debt, we would have to look at increasing tax rates marginally on the very high income earners and closing the loopholes that allow many of America's biggest corporations to pay zero taxes. Zero. That's got to end. It's a really important question. I'm glad you asked it. And it's one that is something that, we have to address, but we have to address it honestly. That means making sure that we're not taxing middle income earners or low income earners. In fact, we need to get more money in their hands because that's what drives the economy, that's what grows the economy, and ultimately that's what's going to eliminate our long-term debt.
Thanks, Congressman, and thanks, Cy, for that question. Our next question comes from Sylvia. Sylvia is from Clio and has a question about small business support. So, Sylvia, your line is unmuted to ask your question.
Thank you. Yes, I'm a realtor, and I'm considered a very small business, and so last year I was only able to get $1,000 towards helping with my business, and then I've had nothing but problems with unemployment since this all began. So I was just wondering if there's anything that is specifically set up for smaller businesses. And then also I have a family member who is married to somebody who he's been working on an immigration issue with his wife for 10 years, and he did not get any stimulus relief at all, through the whole pandemic. And I'm just wondering if that will change now, or is it still the same because his wife does not have legal residence?
Yeah, I think on the second question, you should definitely reach out to our office and we can look into the specific case because each circumstance is so unique that we might need to dig in on that. That phone number again is 810-238-8627.
Okay.
So we will definitely dig in on that for you. The question about small business, you put your finger on a problem that I think is really a serious one that we've tried to address in this legislation. The way the Paycheck Protection Program worked, it seemed that it was not really well suited for some of the smallest businesses. And so we have tried to change the Paycheck Protection Program and the Emergency Injury Disaster Loan Program to be more tailored to very small businesses. I wish, Senator Cory Booker and I actually had legislation that would have created a grant program for small businesses. This is intended to kind of get at that by creating a paycheck protection program and a disaster loan program that is much more tailored to the very small businesses. We did put an additional $15 billion in relief for that disaster loan program and a little over $7 billion in additional paycheck protection program. So yes, the answer is yes. It's also one of the, and it all depends on where you live, one of the eligible expenses for some of the money that's going to state and local governments to set up programs to provide specific relief for businesses.
Thanks, Sylvia, for that question. We're getting several questions about vaccines, and if there's ever going to be a need for a booster shot or additional shots in the future. And so, Dr. Bender, I'm wondering if you can maybe help answer those questions that we're receiving on that.
You bet. So one of the things that is characteristic of the coronavirus is that it changes and evolves over time. As more cases that occur, the more opportunities there are for those changes to accrue. We wind up with these variants you've heard about in the news. As some variants show signs of immune escape, meaning that the protection that's conferred by the vaccines that have been developed is less effective against some of these new variants, then I think it's reasonable to expect that we might wind up seeing future boosters to address those worrisome or troublesome variants. That is something that I know that both Pfizer-BioNTech and Moderna are already working on. And fortunately, with the technology that underlies those mRNA-based vaccines, we can expect that these booster designs for the novel variants could be forthcoming in a very short timeline that wouldn't require the same run-up that the original vaccine development required.
Thanks, Dr. Bender. Our next question comes from Lisa. Lisa is from Flint and has a question about vaccine distribution. So, Lisa, your line is unmuted to ask your question.
Yes, my name is Lisa. I'm from Flint, and I'm calling on behalf of my cousin. She's in her 40s, and she wants to know when she can be eligible to be vaccinated.
Thank you, Lisa, for that question. Dr. Blaney, would you like to answer Lisa's question?
Yes. Hi, Lisa. If you're still on the line, if your sister, you said she's over 40.
She's in her, I think she's actually 40, and I have another question. She doesn't have access to a computer, so I'd like to know how she can get registered.
Sure. We have, like I said earlier, we do have a call center that is available. I can get you the number for that. That will open on Wednesday. And I don't really feel comfortable asking it over the phone because I don't want you sharing her personal medical information over the phone. But if she has any type of medical condition, she would become eligible for a vaccine on March 22nd. If she does not have any type of medical condition, she would be eligible for a vaccine starting on April 5th.
Great. Thank you so much, Dr. Blaney. I'm looking at the clock at 6:31, so we've been together for an hour. So I know we were trying to hold it to about an hour. So, Congressman, I don't know if I can turn it back to you for some closing remarks.
Sure. Well, first of all, thank you, Mitchell, and thank you for everyone who has participated. Lots of people stayed on the call right to the end. I'm glad that you did that because a lot of good information. I especially want to thank Elaine Mogg from the Tax Policy Center for participating, for Dr. Kaylee Blaney from the Genesee County Health Department, and one of our regulars, I guess, Dr. Thomas Bender, who's just always been willing to join us. We'll try to do everything we can to keep everybody updated. These calls are a good way to do it. Obviously, if we could all get together in person, we'd do a lot more of that, but that'll have to come later on when we get almost everybody vaccinated. So thanks for doing this. Again, I did mention, go to our website. If you have specific information that you want to look up, it's at dankildee.house.gov, or you can always call the office at 810-238-8627. Thank you. Mitchell?
Thanks, Congressman Kildee. Really appreciate everyone joining us tonight. We had 8,723 people join us from across the district. So I know we were not able to get to everyone's questions, but if you still have a question, a new question, or maybe a question we didn't get to, or you didn't hear an answer to your question, you can stay on the line after we end this call, and you can leave a voicemail. And then someone from Congressman Kildee's office will listen to your voicemail and get back with you directly. So if you still have that question, please stay on the line and record your message, and someone will get back with you. Thank you so much for joining us this evening. Stay safe, and we'll talk soon. Have a great evening. Bye-bye.